bartering going on.
Actually, is this on? Hello. Hi, I'm Steph Zadek-Chandler, and I know all of you are really hungry, so I thought if anybody needed to get started, you could start with a tree. Good morning. It's really a pleasure to be here with you. It's actually almost afternoon. I'm here to share a little bit about our project, which is TCORE, Training Contract Officer Representatives Effectively. Now, in the beginning, our project wasn't TCORE. It was about helping staff connect to professional development opportunities. The problem, training often didn't deliver what people thought they were going to get or what they needed.
Steph, one sec. Do you have slides?
Oh. Aren't they supposed to be on here?
Yeah, you have to click.
Oh. Oh, great. I don't need the microphone? I might be walking around. Okay, here we are. That's me and the rest of the team. This is what we're doing. I just talked about the problem, and our goal is to help staff find a better fit training and strengthen workforce competency. Our proposed solution was a web-based training feedback system, sort of like Rate My Professor or TripAdvisor. We found out by interviewing a bunch of staff that problems fell into a bunch of buckets, or categories. One problem, however, stood out amongst all of them, had a lot of comments, a lot of feedback, a lot of grief. And this problem was about core training. SAMHSA staff said if there's one thing we can change about training, it would be core training. Chris, Richard, Paul, they were all so frustrated. So we said, hang on a second here. So we decided to take a look at that. What is a core? A core is a contracting officer representative. They manage contracts. They help manage contracts. They have a lot of responsibilities. They have legal liability. They're involved in every process of a contract from start to finish. By a show of hands here, how many of you have had core responsibilities in your federal agency? Okay, so there are a bunch of you that understand the requirements. I get my little clicker right. There's certification, and the certification requires training, 40 to 60 hours for a core 2 or 3. There's recertification. At SAMHSA, about 1/3 of our staff are core certified. They have core responsibilities. This requires about 8,000 hours of staff time. And they oversee about $300 million worth of core or SAMHSA contracts. Now, there's one key problem. All of the core courses taught to HHS were developed to train DoD core. Instructors are former DoD instructors, class instructors. The content is DoD focused. The class exercises, you got it, are DoD focused. Now that is great for DoD staff, but not so good for HHS because we buy different stuff. DoD buys fighter planes and helicopters and ships and boots and guns and helmets. HHS, on the other hand, and SAMHSA for sure, buys things to help reduce, prevent, or eliminate public health problems. We buy technical assistance, education and training, evaluation and research. The problems we have related to understanding the FAR, administering the FAR, and answering questions around our contracts are often very different than those of DoD. Now, we found out by conversations with other agencies that this is not a unique problem to SAMHSA. It's actually pervasive throughout HHS. HHS in FY13 allocated nearly $6 billion for service-related contracts. We have thousands of HHS core that monitor these contracts. So competence is essential. Well, we had a lot of evidence, and we decided to follow it. So we shifted the project to focus on improving core training, and that was the genesis of TCORE. The TCORE goal is to ensure that staff who service core for public health service contracts are appropriately trained and competent in doing this work. We wanted some more information to better understand what did work, what needed improvement, and how do we fix the problem. So we surveyed core at both SAMHSA and CDC. In less than a week, we had over 640 responses. And this is what staff said. Instructors are not knowledgeable about the work we do. Instructors can't answer our questions. Training isn't specific to what we do. Lots of problems. Incompetence really is essential. There were other specific concerns. Concerns that are related to the core functions of what a core does, such as monitoring grants, developing cost estimates, engaging in contract negotiations. Well, how do we fix this problem? The solution is to develop a specific course for HHS CORE. Ensure the curriculum uses public health-related case studies. Ensure that CORE instructors have experience administering this type of contract. What do you want to do next? Well, this is where we're talking to you, Mr. Holland. We would really like some HHS support to take this to the next level and be able to build out a core course for HHS. We know that it's going to make a difference in the quality of work that CORE can do to better manage $6 billion of public assets. That's it for now. We thank you for your support and opportunity to participate in this HHS Ignites program.
I'm wondering if you took the microphone away from Ned specifically so that he couldn't respond. But I think, Ned, you should respond. I'm curious what you have to say about that.
Have you visited with Dr. Billups about this?
No. I don't know who that person is.
She runs contracting for the department.
No, I have not met with that individual. However, I have met with chief contracting folks at CDC and other agencies.
I recommend you meet with Dr. Billups.
I will love to do that.
Okay.
We will help make that connection.
So I'll ask a question. Certainly for the agencies and for industry, this is a good thing. It's the things that industry struggles with as well in terms of training. So I think it's a great project. I'm not as clear as to what the specifics of what you're going to do is different than what's been tried in the past, or what will make it different in the future. Certainly, I think it's a good need, and I think it's a great project. I'd like to learn more about how you're going to do it. Because you're asking for executive help here from Ned, but I haven't been gripped yet by how you're going to do it, and you know, others have probably approached him as well, I would imagine, for funding. But
actually, this has been recognized as a long-standing problem when I talked to the other agencies, and they all said we just never had the funds to fix it. And so we came along, we conducted all these interviews, and the driver is for CORE to complete the hours. That has been the driver, complete the hours of training, not ask the question, is the training effective? Are our people able to do what we want this training to be able to do? So unfortunately, I came over and turned over the egg, and everybody said, oh my gosh, we are so grateful that you are starting this initiative because we really need it. We talked to vendors. Well, how about if you guys go build us a course? Well, we can't guarantee that we can provide students. And so there wasn't a cost incentive. DoD's bigger, they just have these courses, they have those instructors. So we weren't, so the sentiment was that we'd probably have to build a specific course that dealt with public health service related issues. And really, the rules are the same, the FAR regulations are the same.
Can I jump in on what you just said? Because I want to follow up on what Peter said. So I don't know if you noticed, when you asked how many people raise their hands if you've taken a core course, our shark over there raised his fin. So I'm glad that he knows how to purchase aircraft carriers now. But but I'll start with, instead of starting with a new course, is there a particular module within the course that would make it makes sense as a first place to start? Like, let's replace aircraft carriers with X. So that's like, did you hear from your interviews?
The chief improvement that's needed for the courses is to integrate public health service class exercises. Every day of the course, you spend hours, depending on the course, working on problem solving or doing a specific task, a core task, but they use something that's not very relevant to the work we do. And when you ask questions, or when students say they ask questions, the instructors who come from a DoD background have not been able to address those.
I'm going to go back to what I asked you in the first instance and say more. I didn't mean to be quite so glib, but it's interesting that you asked me. This isn't in my territory at all. There is an assistant secretary for financial resources. She and I don't look much alike, so I don't think you have us confused. She is responsible for a group called OGAPA, the Office of Grants and Acquisition Policy. Angela Billups, who I mentioned a minute ago, runs grants policy, acquisition policy, not grants. And she's actually responsible for the training of contracting officers throughout the Department of Health and Human Services. And if we're just completely missing that thread, that's a bit of a concern to me.
Absolutely, and it is a concern. And I just want to ask those people who said that they have core responsibilities out there, do you think we need some improvements in our core class? Say yes or no. Say yes loudly if you agree.
Yeah, no, I'd like to see more about how you're going to do it, because I think it's certainly definitely an issue that we can improve upon. So I think there's a lot of upside to the potential of solving some of this training challenge.
You know, it's kind of funny. When we started this project, we had kind of a glitzy web, high-tech idea, but our interviews led us down a very different path. And it was a very important path, because a training issue that stood out amongst all the others was core training. It's process improvement. I don't think it's going to take a mountain to move it, and I think it'll make a big difference.
All right. On that note, thank you very much, Steph. That was great.